Oh my God! Okay, it's happening. Everybody stay calm. What's the procedure, everyone? What's the procedure? Stay calm. Wait.
Coming up on this episode.
It's patient advocacy because that includes educating ourselves. It really encompasses it all.
Welcome to What the Healthcare Podcast. I'm your host, Emily. Today is Thursday, November 7th, 2024. And today I am blessed to have the lovely Lynn. Lynn she's a chronic pain patient, but she has mastered self-advocacy and is helping to teach others. So welcome, Lynn.
Thank you for having me.
Yes, thank you so much for being here. So let's just start with, tell us a little bit about who you are and what led you to what you're doing now.
I'm 42. I'm riddled with anxiety, so just bear with me a little bit here. I've been a part of the medical world since I was 11. Back in 1993, I was diagnosed with type 1 diabetes, and it has been a whirlwind of gaslighting in the medical community and also with like family and friends. And to no fault of their own, with my family and friends. They didn't know any better, and we didn't know any better. But it's just been a lifetime of gaslighting and navigating the healthcare system. And I've learned a lot. I found that Western medicine didn't work for me. And I was doing what I was told by the doctors, right? Because they're the ones that are educated in these fields. This is what they're going to school for. They're the specialists, right? So you do what they say because they're trained in it. And I was doing what they said for a very, very long time, and it made me sicker. And eventually I was just like, something's got to give. And TikTok, in a roundabout way, saved my life. It really did. I was going down a very bad path with the medicines, making me sicker and sicker and keeping me bedbound and in and out of the hospital with bad reactions to all of the meds and stuff. So through TikTok, in the end of 2021, something clicked, and my friend Angie, and oh my gosh, she's wonderful. I credit her with saving my life.
I know Angie.
Yes, she's brilliant, and she's got a heart of gold. And she planted a seed, and I just took it and ran with it. And I just overhauled my entire way of being. And I've learned from many other people on the platform about my conditions, about advocating for myself, about not allowing people to tell me that I'm crazy and that I'm making stuff up in my head, because this stuff is really wrong with me, right?
Mm-hmm.
And getting answers and pushing, and it's been great. It's been wonderful. It's been a struggle, but it's been a lovely experience, and I've come across some fantastic creators, and it's a big support system for me. It really is.
That's wonderful. I do find it's like every time I have somebody on here who has dealt with the medical system in any sort of way, there is one commonality, and that is the gaslighting.
Yes.
And, originally is that me or somebody else? Sorry, I heard a beeper going off.
That's okay.
Originally, I thought this platform was going to be a bit more designed to have healthcare providers, nurses, doctors, things like that. But I have found that because of the gaslighting, patients really need a platform to be able to share their experiences without having pushback. And I don't really, I kind of think I know where a lot of that comes from. And I've said this on probably every interview I've had. People like you, I have so much respect for. And we talked a little bit about this on the phone as well, that, you've taken the time to dig down deep and learn these things. Now you're teaching these things, and it makes somebody like me feel like an idiot because,
oh, stop.
Well, it does. I mean, honestly, because we're so indoctrinated in the industry that there is like a one size fits all treatment for every ailment. And if you do not fit inside of this box, or if a patient dare questions your authority, it's like, I think that's where a lot of the gaslighting comes from.
Yes.
So I know we talked a little bit about when we had that phone call that your journey really started as a child, right? You kind of entered into the system as a child, and it followed you along through your life. You've kind of had no choice but to stay in that industry, but you seemed to have kind of mastered it to use it how you need to use it, how it benefits you. You've learned how to interview your doctors, but you're also using a naturopathic modalities, I think, as well, right?
Yes, I do. I do both Western medicine and holistic, but for the most part, the natural stuff works for me and my body a lot better than most Western medicine does. Yeah. Western medicine is an absolute last resort for me.
Okay, fair enough. So walk us through your childhood a little bit, if you don't mind. Share what you feel comfortable sharing. But what can you remember? The time when you were started to be kind of dependent on these doctors, on the industry.
Yeah, so again, it was November 11th, Veterans Day, actually, was when I was diagnosed. Thank you, everyone, for your service, by the way. So I had been sick for a while. I remember that Halloween back in 1993. I was really sick and had a tough time trick-or-treating with my friends and stuff, needing a lot of bathroom breaks and just thirsty all the time. So we didn't know it at the time, but it was the type 1 diabetes. So my mom thought I had mono, actually. So insert like gaslighting in the family. I love my mom. I love my parents. They've done a big turnaround and stuff, but they didn't know any better. Diabetes doesn't run in my family. So they had no clue. Mom thought I had mono. So she called my pediatrician and was like, I think my daughter's got mono, just call in an antibiotic. And they're like, no, we kind of need to see her. So we go there. My blood sugar was 595.
Oh, wow.
So normal blood sugar is between 80 and 120, although they've changed those ratios these days. I can't keep up anymore. Everything's changing. So, and then, so that was at the pediatrician's office, and they're like, okay, well, Lynn needs to go to the hospital right now. They're holding a room for her. She's going to be inpatient. And my mom was like, all right, well, we'll just drive home first and pack her a bag. And they're like, no, you don't understand. You're going to go now or we're going to get her there by ambulance. Oh, okay. So that was like the big introduction to me. And I had some medical problems before, very minor, tubes when I was a little kid, but nothing major. This was like the first big thing. And the team, I just remember being surrounded by so many people, and you would think that it would be overwhelming and that I was scared. I wasn't. I felt comfortable. I felt safe and like I was being taken care of, and I was also, they said I was almost in a coma. So I was like, someone's helping me and doing something finally. So I was able to just like relax my body and just let it go and let them do their thing. It took them 2.5 hours and I think 26 attempts to get an IV started on me.
Oh my gosh.
Yeah, it was, and yeah,
because you were so dehydrated.
I was so dehydrated, and my veins are just horrible. That's how I'm built. I've always had a difficult time with it. They had to call in someone from the helipad, like the helicopter people that would do it was a pediatric, I don't know her title. It was someone specialized in pediatric. They called her in and had her drive in to get the IV going on me. Wow. So that started everything really, and my parents and I and my brother, we took like diabetes education classes, and then my parents from the beginning, thank God they did. I would not be where I am right now, and I would not have been able to navigate it in adulthood when I left at 18. They had me involved with the healthcare stuff from the beginning, between all of not showing me the bills, but seeing, there's bills coming in and the ordering supplies and the making the appointments and following up with insurance because there was improper billing and wrong coding and the pharmacies. So I've been involved with it from the beginning. They didn't overwhelm me from it, but they were kind of like, this is your life now, so you need to be a part of it. So in terms of the paperwork management part of it, I've been involved from the beginning, and I really don't remember any differently. I don't. It's just been ingrained in my head for
smart.
A long time.
Your parents to do that. Very smart.
It was smart, and they wanted to protect me, and they did. But also protecting me is not minimizing how important this stuff is. And I didn't take care of myself. I didn't. I was angry. I was very, very angry. I didn't want this condition. I had it. I was living with it. I was doing what I needed to do. But I was very angry for a very, very long time because it wasn't fair. What did I do to get this? It's not fair. And I never really thought about it because I handled it so well at the time, but it really was traumatizing, you know? And it's the complications with the type 1 diabetes that's the big problem. And they drill that into your head. If you don't do this, you're going to get this. If you don't do this, you're going to get this. But if you do this, you'll be fine, or you'll hold things off. That worked in terms of a lot of my body not shutting down until much later on, like the things happening, like vision going and stuff like that. But everything, I've got my flu shot every year like I was told to, like a good little girl. And, you know, it turns out all these years I was having bad reactions to the ingredients in the flu shot.
Wow.
And I'm not against them. Listen, I mean, I am for me and for a lot of people. But again, there's a place for Western medicine and there's a place for other alternatives. How did people survive back in the day when all of this stuff didn't exist? You know? I've just been, I lost my train of thought because ADHD, but
yeah, you're okay.
It's been a whirlwind learning everything and navigating this, but my parents really did set the framework for me to be able to
Take
survive
over.
and
Yeah.
to go there. Yeah. And to start advocating for myself. But I was a rule follower. You know, I didn't want to disrespect anybody. I didn't want to disrespect elders. I didn't want to disrespect the professionals. But it came to a point where it was like, no, I'm the expert on my body and you're going to listen to me. Respectfully.
I'm curious, since you have been part of the system for so long, since you were a child, I imagine you've kind of seen a change throughout the years. What has that been like? You know, like you started, I assume, correct me if I'm wrong, but trusting in your team of doctors and doing what you're supposed to do. Like as the years went on, because often, you know, every 4 years, changes are made in the healthcare system, regardless of who is elected. And so could you feel that as a patient? Could you see the things changing, and what did that look like?
Yes. So it's almost, I go to the doctor so often, so it wasn't like a shock to me, but I could see it gradually changing. And for me, what I found was most of my providers historically would spend their time with me, and when you're there for, you know, a 45-minute, 50-minute visit, they spent the whole time with you. And it's very different now. It's very rushed. It's very in, out, boom, 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 buy the book and get out. Whoa, well, you don't meet this little rectangle box, so you're out of here. You're a circle. Actually, I'm a square. You know what I mean? I'm kind of in between the two of them, and you got to read between the lines for things to work. I think people in the healthcare industry, they're there for a reason, right? They're passionate about what they do. They want to help people, and they're knowledgeable in it, and they're knowledgeable from a bigger perspective. And it just seems like there's been so much government involvement in our healthcare, and they don't belong there because they're not my providers. They're not. And they're not part of my team. The government is not part of my team, other than Medicare, which is a separate issue. They're awful. But I just find that because they're being so, the providers are so restricted with what they're allowed to do, and they need their jobs, right? They need a livelihood too. So they're doing what their higher ups are telling them to do. So there's not as much compassion. There's not as much push for you. Doctors used to do, you know, peer-to-peer. They would call your other providers and say, hey, this is going on. What are your thoughts from this perspective? They don't do that anymore. And I've asked for it, and they refuse to do it. It's really sad. And I understand it takes up a lot of time. There's so many factors, but the number of people that are now chronically ill has gone, like, it's exponentially increased. So there's a higher demand, but there's not enough supply. And the supply that's there, you got to find the needle in the haystack. And if you want the best care and you want providers that do care and do listen to you, you're going to work for it. And I've worked my butt off to have the team that I have, and I'm so grateful for them all. Yeah.
I'm so grateful that you've been able to do that. And I want to get into that some too, because I think a lot of people forget that this is a service and you're paying for this service. And we are missing that continuity of care. Even if you see a provider or several providers within the same network group of doctors, oftentimes one does not know from the other what the other has done in your chart, and they don't have the time to pick up that chart and read through it. And so, and I'm curious too, if you've seen a drastic change in that service. Like, did you feel like it used to be as a patient that they did spend that time with you, that there was that continuity and then it disappeared? And if so, like, when did that happen? I have my suspicions, but I'm curious from a patient perspective, when you saw, or maybe you didn't, maybe it was just a gradual change over the years, but was there a time that you feel like it really changed?
I started noticing how bad it was getting probably, I'd say about 10 years ago, honestly. And I don't want to point fingers at anyone or anything, but in my opinion, the attempts to try to get everyone universal health care coverage, which is very much needed, right? I'm not arguing that at all. It's just the methodology for it hasn't worked, and it's impacted people negatively, many people, significantly. So I'm not going to like throw out names or anything like that, but or situations or anything like that, because again, it's been a gradual change. It wasn't an immediate flip. But I think when the higher ups in the government were trying to start honing in and getting control and trying to get a handle on getting coverage for everyone, I think that's when it started, big time. And it's traumatizing at times. And I don't say that lightly. I do not say that lightly. And medical PTSD is very much a real thing. And I'm talking panic attacks on the way to appointments and needing anti-anxiety medication in order to go there because I'm like vomiting. It's one of my physiological side effects of my anxiety. Because you don't know what you're going to get. You're so sick of being told that your symptoms, you're faking them, or that you're exaggerating them, or the blood work comes back fine, but it's not fine because they didn't run the proper labs. And yeah, I really feel like in an attempt to try to help everyone, it hurt a lot of people. I really do.
Yeah, I agree with you on that. I think they've got to do some work on the system itself first, because just shoving everybody into an industry that was not equipped to sustain that amount of patients, it wreaked havoc. So I agree with you there.
It did.
What was it like having to navigate your regular visits and your routine care during COVID?
Okay, so I missed. I
got to get into it a little bit.
Yeah, we do a little bit. That is excellent question.
Yeah.
I went down. My health went downhill during COVID, big time, because a lot of the providers shut down, right? And they were only taking urgent visits, or they were scared to have you go in. I still went when I needed to, and for my endocrinologist, I would go there as routinely as possible. During that time, I actually missed out on a lot of my eye appointments with my ophthalmologist. There was about a 2-year period when I wasn't going to get checked because it wasn't in the cards for multiple reasons. And my eye conditions have progressed significantly as a result of it. Yeah, that's a big one. It really is. I pretty much just stopped going. It was too much, and I still went, but there were a lot of providers that went on the wayside. I wasn't keeping up with my dental appointments. I wasn't keeping up with the vision appointments, and both of those are humongous in terms of a recent diagnosis that's less than a year old, or just about a year old for me. So it wasn't a smart move for me, but I did what I had to do. There's a big piece of it, the physical health, that a lot of people don't talk about, and that's mental health impact, right? Because if your it's a vicious cycle. When you're physically not feeling good, you psychologically don't feel well, and it's a vicious cycle. Well, it's also the same in reverse. When you're psychologically not feeling well, you're not going to feel well physically.
True.
So for me and many others, it's so important to ensure that you're managing your mental health in addition to your physical health. There's got to be a balancing act. So once I ran into Angie in 2021 on TikTok, that's when she gave me the confidence boost and the mental health reset, honestly, that I needed. It was like, oh, so there is hope for me. Great. I'm going to try a different route and I'm going to go down here. So, and that was right in the middle of the COVID stuff, you know?
So you were kind of looking for different avenues because of what was happening during COVID?
I wasn't necessarily looking because I didn't know what else was available.
Okay.
Because what I was told through the medical community was this is what you do and everything will be fine. And it wasn't working for me. So I ran it on TikTok. I always stay on my For You page because it's whatever's meant for you will come to be, right? Like here we are today because it just happened. So I ran into Angie and she was doing an individual study for herself, nothing professional, nothing funded, because she hadn't gotten COVID. And I never got COVID. I still haven't gotten COVID to this day. And we're both immunocompromised. We're both chronically ill. And she was like, I wonder how that is. And I was curious too. So she was wondering if there was a genetic component to it because she was doing some she sequenced her DNA and she wanted to see if other people had similar genes that hadn't had COVID. And I was like, well, this is really interesting. And I originally went to school for biology and secondary education. I love this stuff. I'm really nerdy about it and I love learning. So I was like, this is really cool. Let's find out. So I had my 23andMe results. I did that back in 2017 before I was aware that the government owns it now. But anyways, it doesn't matter. They've got everything as it is. So have my DNA. Have fun figuring that one out. So I sequenced the DNA and I had the same genetic marker that Angie said that she had. And that there were hundreds of other people that had never gotten COVID and had there were 2 gene markers. And she was like, we must be genetically immune from it. And I'm like, that's brilliant. That's amazing. And then she commented on another one of my videos a couple months later. And she was like, I think this is what's going on with you. And I was like, thank you. We're overhaul time. So when I say TikTok saved my life, it literally saved my life. And Angie's been a phenomenal support for me throughout this entire process. And just, why did I never think about the genetic component of these things? Why?
I wouldn't have. I mean,
why?
I don't know.
and the doctors didn't either. Why didn't they? Because again, through that, and then I don't know a lot of it, right? I have very surface level knowledge of it, but enough of it to get by what I need to. And having my DNA information available to me, I have taken that to my providers and been like, you don't get to tell me that I don't have it because I do.
Good for
and
you.
Then they're like, oh, well, yeah, so here, we're going to get you this medicine and get you going really quickly. I'm like, no. No. We're not rushing into anything. I'm going to research the medicines you told me, and I'm going to see if something else will work for me that works for my body. So, yeah, it's been a game changer. My body wasn't absorbing the vitamins that they were telling me to take because I didn't have I have a genetic mutation. And a lot of people have it, and they're not aware of it. It's MTHFR.
Yep.
And so I had no clue. I didn't know about it, and I didn't know that I had it. And thanks to 23andMe and Angie, I found out that I had it. And then I started taking the appropriate supplements for me so that my body could absorb the vitamins. And boom, my health did a complete turnaround.
Wow.
It really did. And I've just been building up off of that with my different conditions and just managing things the best that I can.
That's awesome.
Thank you.
Yeah, I first of all, I've spoken to Angie. I've got to get her on here. She is a very intelligent woman.
She is brilliant, and she's so kind.
She is.
I would. Yeah.
She's a sweetie.
She really is.
So I've got one more quick COVID question. When you were having to see providers during that time, did you feel pressured by them to be vaccinated, or kind of the standard precautions they were forcing people to mask up and vax? And did you feel pressured, and did you run into any instances where they wouldn't see you if you didn't do these things?
I felt incredibly pressured to the point where I was talk about like the mental health and like component, and I was like ready to snap on a lot of my providers because we were at that time we were still troubleshooting everything, right? So I was diagnosed with multiple sclerosis in September of 2021, again in the middle of the pandemic and everything. And I started having symptoms of multiple sclerosis in 2012. The left side of my face went numb, and they just ignored everything, and they were blaming my diabetes for my symptoms for everything, and it was frankly pissing me off, and it still does to this day. It makes me very, very angry that everything gets blamed on the diabetes, everything. I was pushing and pushing and pushing, and my local neurologist here, my first neurologist, she wouldn't do a spinal tap to rule out MS. She wouldn't do it. And she was just like, no, it's your diabetes and it's damage from migraines. That's what the lesions are, your brain are. It's damage from all of your migraines. Okay. So I got a second opinion. I went to Mass General and they did massive blood work. It's multiple sclerosis.
Wow.
And I'm so sorry, I lost your train of thought. You let me into that.
You're fine. I was asking about, did you feel pressured to would they refuse care if you were not vaccinated or masking? But that poses a very interesting. I'll let you finish what you were going to say about that. But
sure.
Yeah, go ahead.
Thank you for reeling me back in.
Yeah, no, you have to reel me sometimes too. It's okay.
Okay. So, yes, I felt incredibly pressured, right? I was pressured to get the flu shot every year. I stopped getting that in 2019 was the last year that I got it. Again, just because of COVID, and it wasn't important to me because I wasn't going anywhere. I was staying home. But they were definitely pushing for it. And I said, listen, we're troubleshooting right now. We don't know what's going on. We're looking into multiple sclerosis and all this other potential things going on. I don't want to add any complicated factors on top of it. Let's just stick with where I'm at. And in the beginning, they were agreeable to that. They were agreeable with that. They were like, yeah, you're right. We should just take it easy and, let's see what's going on, and then we'll discuss it. Well, once I got the diagnosis, they were like, all right, well, we know what it is. Now you should really get it because you're immune compromised. And I'm like, no, it doesn't feel right. Something doesn't feel right. I'm not going to do it. And I wasn't denied treatment, right? But I was very much frowned upon and spoken down to. And it was almost like their focus was on making sure that I got the vaccine, right? Making sure that I got it because that was their most important thing. Again, I get it. It's drilled into their head that it's supposed to help, but I knew that not enough studies had been done on it. I knew that. I know that it takes years for a new medication to go through its clinical trials and studies and things like that. And I knew that the vaccine, the COVID shot hadn't gone through all that, and I was not comfortable with it given how high risk I am. And I stand by that decision. I'm very glad that I didn't do it. There's actually a study that came out that said the vaccine and it severely has negative impacts on folks with multiple sclerosis. And there's a lot. I have personal friends that have gotten it, and they're very, very sick now, and they were perfectly healthy before. It's very sad. It's very sad. But you know what? They're coming to me, and they're asking me, like, how do I do this, and what am I supposed to do? So it's very fulfilling for me to be able to help my friends because I don't get to do stuff and go out and have fun and interact with everybody. And I love helping people. It's very, very rewarding for me. So I get to do it from my home and from my phone. I don't have to go out anywhere. Mm-hmm. So yeah, it's worked out, but I felt very pressured to do it, but I stood my ground. I wasn't getting it.
Good for you.
Even my family was pushing for me to get it too. I was like, nope.
And that was hard to do, so that's admirable. It was not easy to push back on some of these doctors. I'm glad that you didn't face any that refused to see you or put the amount of pressure on you that you had to succumb to it, but because a lot of people did. People, and I will say there is one positive, and there's probably more, but I go back to this one positive that came out of all of this, and that is that many people no longer have this blind trust in doctors and in the system. And it's not that doctors are bad people, but we are all indoctrinated into this industry. and it just is what it is. That's the truth.
Yeah.
And so a lot of people have kind of woken up and are now taking their health into their own hands. And I don't think that we're going to change the system, at least not yet, but we can change how we approach it and how we navigate it, and, you know, learn to use some of these other modalities. So, and my gosh, you know, back to the MS, if you had not pushed for that and sought a second opinion, like, I mean, that's a substantial,
It is.
that's huge.
It is. It is. And I was scared. You know, you get intimidated by these people because you're trusting their judgment for what they specialize in and what they went to school for. So why wouldn't you trust them? It really messes with your head. It really does. And it gives you a sense of you don't know who to trust and you don't know what to trust, and you second guess everything. And you going into appointments, especially with a new provider, you don't know what to expect. It's scary. And I'm not as I'm slightly desensitized to it, again, because I've been in the medical arena since I was a kid. So this is nothing new to me. But if you get someone that's newly diagnosed with a chronic illness, or even just something like a cold or anything, and they're just not used to the medical community, and they're going into this and they're getting bombarded and almost cornered, that's intimidating. It gets intimidating for me at times, and I've been a part of this for a long time. So it's really important to know your body and take your time, right? And we still need these providers, right? Because they do have the subject matter expertise in certain areas, and they have the education in it, and they know a lot more about it than we do, right? And we need them for testing. We need them to interpret blood results. You need prescriptions for a lot of things. So they've got us in handcuffs in a way, you know? It's finding my voice has been the biggest thing for me. It really has, because I had a lot of this knowledge in my head and it just, nothing ever felt right. And I didn't know how to go about it and say, no. I didn't know how to go, because I don't like confrontation. It makes me,
I don't either.
It makes me so uncomfortable, but also I like having discussions and I need to understand something. So now, until I fully understand and fully agree with a treatment intervention, I'm not doing it. I'm not doing it. And my providers know that, you know, and they're okay with it. They don't agree with it, but they accept it. Just
Well, that's
like
good.
I don't accept a lot of their recommendations, but I hear what they're saying, and I just find an alternative for it, for the most part.
You have now kind of built this team around you of doctors that suits you. So I assume you kind of had to weed through some of them.
Yes.
Like the woman that refused to do the testing for MS. Is she still part of the team, or?
Absolutely not.
Okay.
So she was no, thank you. She was the first neurologist that I was referred to, and here's the funny thing, right? Is my ophthalmologist. I love her. I've been with her for over 20 years. She's the one. I was going for one of my routine eye exams back in 2021, and she's like, "Lynn, I think you have MS." And I'm like, "Oh, really?" And she's like, "Yeah, your eyes have like there's so much more inflammation." She's like, "Something's going on." Now, there's a lot of health conditions that you can talk about, you know, the eyes see everything, and the eyes are the window to the soul and everything. She can literally see stuff going on in my eyes with it. And she's like, "You should really see a neurologist." I'm like, "Okay, I'll listen to you. Sure, you've never done me wrong so far." So my ophthalmologist, not primary care, no one else. It was my eye doctor that referred me to the neurologist and took my symptoms seriously.
Wow.
So she wasn't working out, the first neurologist. I stayed with her, and I was like, I'm going to get a second opinion. I went out to Mass General, which was at the, I'm going to say demand of my parents. Like, my father was like, "You're going to go here, and you're going to get this done. Enough effing around. Do it." And I'm like, "All right." Because when my dad gets like that, you're just kind of like, "All right,
Okay.
I'll listen to you." So I did. I went out there. I stayed with my parents for like 3 weeks for all the testing to get done. They did the spinal tap and a whole bunch of other blood work, and it confirmed the multiple sclerosis. And here's the best part. I was back home in New York, right? And because my parents live out in Massachusetts. So I came back home, and we were waiting for a couple of the some of the labs to come back still. So I was back home, and then it came through that the neurologist in Massachusetts, he's like, yes, you have multiple sclerosis. I got a phone call from that first neurologist because I was still technically a patient of hers. She goes, "Oh, Lynn, guess what? You have multiple sclerosis. It's a good thing we caught it early in time. We can take care of this now." I was like, "You've got to be kidding me right now."
Not.
Yes, she did. She absolutely did. And I'm like, wow. So I was like, well, yeah, why don't we come in and we'll talk about it? So I went in, and I was like, you didn't do the spinal tap on me. So
Good
why
for
are you the one that's
you.
going to be trying to treat me? Well, what'd you go for a second opinion for? Because you dismissed me. Why would I come back here? I don't trust you.
Good for you.
It was so empowering, and it was a lot. It was, I had so much anxiety building up to that. I had so much fear. I was afraid something was going to go in my chart, like, because I had doctors put non-compliant in my chart because I won't take a medicine that I'm allergic to that they've tried prescribing me. It's just, it messes with you big time. So that's where that began.
Wow.
So I have my neurologist out in Boston. He's fantastic. I love him. And he's on board with managing things holistically. He's like, I'm not well trained enough in it. He's like, but it seems to be working for you. We'll monitor it closely. And if things keep progressing, then we'll discuss other alternatives. But for now, keep doing what you're doing.
That's great.
And he's great. He's wonderful. So he referred me to a colleague of his back here in Albany. So I was seeing him. That was my third, I call it my third neurologist. Same thing, pushing the vaccine, pushing the medications for me. Now, I went on the medication. I was on Kesimpta. I tried it, and I was fine for the first month. After that, horrible. I had horrible reactions to it. In and out of the hospital, and I ended up deciding to stop it. But the neurologist, and then that's when I went to the holistic stuff after that, after trying that medicine. So then the Albany neurologist kept pushing that, and I made a deal with him. I said, listen, can we do another MRI and see if there's been any progression or changes with the lesions in my brain? And let's make a deal. If there's changes, then I'll start taking one of the MS medications that you're recommending. It was a Aubagio that he wanted me to take. And I said, but if there's no changes or things improve, you're not going to push medicine on me, and I'm just going to keep doing what I'm doing. And he's like, okay. He did the MRIs. There were no changes. And in fact, pineal, I think I'm saying that. I had a pineal cyst. It was 11 millimeters. It shrunk since going holistic. Yeah.
Wow.
Yes. And he was like, all right, well, it looks like your MRI looks great. And he says, all right, let's get you on the medicine to make sure it doesn't progress any further. I was like, no. I felt, So that's when I started looking for another neurologist. So I'm on number 4 now. And she's actually a nurse practitioner. I find that the nurse practitioners are much more reasonable, much more compassionate, and want to spend the time with their patients to get them a better level of care. That's just my personal experience. And my new neurologist nurse, she's fantastic. And she has a lot of patients that do a balance of both Western medicine and holistic, and it works for them. So, yeah, I'm on number 4. I still see my Boston neurologist once a year for the annual checkup and a big full system review to make sure everything's intact and everything. And they're also a teaching hospital there. So he's an associate professor at Harvard. He's the director of immunology and neurology over there, and he's brilliant. And I love interacting with him and learning from him. I really do learn a lot from him and the residents that he has come in. And some of them learn a lot from me, and a lot of them, like you're saying, they're so indoctrinated. They're just like, you have to get on this or you're going to be bad. I'm like, whoa, back off. So there's a couple on my team. Most of my team actually has been me advocating and doctor shopping. And I was always like, I shouldn't doctor shop because they're going to think I'm like needing or looking for stuff. No, I deserve the best care. I
do.
deserve care. I deserve providers that are going to be realistic with me and support me and help me and encourage me and take what I'm saying as truth because it is. Yeah, I had to change my primary care provider for various reasons. I was feeling she changed significantly with COVID. She did, because she used to be very compassionate. That's the thing. My primary care, I was with her for probably 20 years. She kept saying, you got to fix your gut health and take care of your diabetes and everything will be fine. Oh, okay. So I was following what she was saying, the dietitians were saying. I did everything by the book and I still was sick. It turns out I was eating stuff that I'm intolerant to, and it was making me sicker. So I changed providers with her relatively recently, and I'm now with internal medicine, who, in my opinion, has a better view of the entire body and how it all interrelates with everything. And she takes her time with patients. She does, and she's very compassionate and very kind and very caring. And she says what my neurologist in Boston says. I'm not medically trained in this, but I'm aware that it helps a lot of people, and I'm fine with it as long as there's no urgent thing going on, and you come to me when there's something urgent going on. So we have that great respect. It's a respect thing. We have that respect for each other. I respect her knowledge and her education and her experience, and she respects mine. It's lovely.
That's a good provider.
Yeah, she's wonderful.
I think a lot of people in general, but doctors and nurses too, specifically, I guess, during COVID have lost their empathy, kind of disassociated, and it's sad.
It is.
Speaking of gut health, I have heard, I'm curious if you have, that there are doctors out there who have said, and I think there's been some research. I think Mark might have given me the name of the doctor. Dr. Lee Merritt is one of them, who has stated that there might be a connection with MS and parasites. Have you heard anything about that?
I sure did, and I brought those studies to my neurologist in Boston in my binder. I was like, check this out, doc, and he was like, wow. Yeah. So
tell us more.
Right. So they're spirochetes. They did. I don't remember the name of the study, and there's a handful. There's not a lot, right? Because if they find the true root cause of a lot of ailments, you can't patent something that's naturally occurring. So there's no money in it, right? There's no money in a healthy patient, and it's really sick that a lot of people look at it that way. And they may not look at it, but blind compliance, that's what you're complying to.
Yep.
So yeah, there was a study that I came across where they did autopsies of X number of patients that had multiple sclerosis, and they found that the lesions in their brain were spirochetes. And liver flukes was another one that came up with it. I'm like, wow. And that's a big part. A lot of other countries do these parasite cleanses regularly.
Yep.
So I'm like, huh. And there's parasites everywhere, right? And there's good and bad. There's healthy bacteria and bad bacteria. I did a parasite cleanse. I do them gently because my body really is sensitive. So I have to be careful with doing them. But I did my first parasite cleanse, and I felt so much better. And there's a lot of people that had these stories of like the tapeworms like coming out of them, and
scare me.
I know, I don't like bugs. I was really freaked out. I didn't do it for a while because I was like, oh no, I'm not going to be able to manage that. But that didn't happen to me. A lot of this stuff is microscopic, so you don't see them exiting your body. So yeah, I do parasite cleanses. I do about 2 a year now. Okay. And it's funny you ask. I did a parasite cleanse not too long ago, and I just got the report back. No parasites. No parasites now. So whatever I'm doing is working for me. But yeah, it's fascinating. Parasites are one of the root causes for many chronic conditions.
What was the doctor's response, the neurologist's response to that?
He said, wow, I never knew this. And there was a couple of other research papers that I had brought to him and supporting my way of managing my multiple sclerosis. He flat out said, "You should have been a doctor."
Oh, wow.
I started
Flattering.
crying.
Aw.
It was so flattering, and it was humbling. It really, really was. And he said, "I'm not well trained in this." He's like, "You should," he says, "you should be going online and telling people what you're doing and help other people." And I said, I do, and I love it." And he says, "Good." So he's like, "Well, keep doing what you're doing." Um, I said, "Well, maybe you want to open up a little clinic with me, doc."
Yeah.
He's like, "No, I'm not trained in it. I'll stick with what I'm
Oh.
trained in." He's like, "But you keep doing it." I know. I was so helpful.
Yeah.
I was so hopeful for it. But yeah, he was blown away. He's like, "I never knew this." And he genuinely took the stuff and read through it. He took his time and read through it all.
That's a good guy.
He's fantastic. He really, really is. He's another needle in a haystack doctor. Yeah.
Yeah, I mean, well, for myself too, it's very like I had never heard of parasites. Like, I kind of it makes sense. I mean, if animals can get them, we can get them. But and I never knew that it was routine in many countries to, to do those cleanses. I have a cleanse that sits in my bathroom cabinet that I should be doing, but I'm terrified.
Yeah, right. I know.
So, but yeah, interesting. So, and I have heard too, again, it's not something I'm well versed in yet. I need to do some more research. I feel like when I came out of the system, there are so many rabbit holes to go down. And you can really get lost in them.
Yes.
So that's one that I have not gone fully down yet, but I can see where there'd be a connection. And you are right. We have a system that profits off the sick. The sicker we are, the more money they make. That's the truth. And I don't think that the system was initially designed to be the business that it is. But going back into history, Rockefeller changed that.
Yes.
Private equity has changed that. And these big companies, pharmaceutical companies and insurance companies have changed that. And so it is now a business more than ever.
It is.
Yeah. So, and then you look at the food corporations. I mean, I don't want to get too conspiracy, but it's all one. I mean,
It is. It's not a conspiracy because it's true.
It's true.
It is. So I don't, there's the denial is not just a river in Egypt. You know what I mean? Like it's true. They're just got to take their blinders off,
Yeah. I know, but it's hard to do that.
It is. The food, nutrition. Listen, I don't like a lot of things, all right? I'm very finicky. I'm very picky eater, and I always have been. For me, it works out because there's only certain foods that I like, and some of them I can't have anymore, right? Because they don't agree with my body. But the plain, bland foods works for me, and they're healthy for me. I do all organic now. When I tell you, I used to laugh at all of these people being like, organic.
Me too.
So prissy or whatever the word, insert appropriate
Do your
adjective
organic.
here. Yeah, go ahead, do it. Gluten free.
Yeah.
Well, Lynn, you're also gluten intolerant too, so there's that. Like that was part of the problem all along. So yeah, it's just I have to laugh. Well, I don't have to. I choose to laugh, right? Because I've done so much crying. I've been angry for so long, and I choose to just take a different viewpoint on it. But the food, I learned so much. Once I was awakened to all of this stuff, I have not been able to unsee it. And there's so many rabbit holes. Even with the parasite cleanses, though, too. There's different ingredients that don't work for some people, especially with that, like MTHFR genetic mutation and stuff like that. So it is imperative for me and everyone really to do your research on what you are taking in to your body and how it may impact you. And listen to your body. If something doesn't feel right, don't do it.
Yeah.
Don't do it. Just stop it. Although a lot of the parasite cleanses, you're going to feel kind of yucky for a little bit. That's kind of comes with the territory.
I know. That's what I'm scared of, like that. And what, God only knows what's going to come out of me.
What comes out of there?
I mean, it's been 44 years. I don't know. I've never done it before. And I used to eat a really, crappy diet. I'm much better now about what I eat. I've learned, and again, this is when I start to feel like how was I this naive? I know that you will get out of your body what you put into it, but
Yes.
for years I took, way too many prescription medications. I ate sugar like it was nobody's business. It's like so many things. And since coming out of the system, I've been able to, I've changed my diet significantly. I try to eat at least mostly organic,
Yeah.
because there's so many pesticides. Like, I mean, it is a huge, huge rabbit hole.
It
And
is.
for somebody that, like, where do you direct somebody to start? Somebody who is wanting to make a change or wanting to start, because I think that just the overall research in itself to learn all these things is so overwhelming, and there's a lot of people, myself included, that it's like I don't even know where to start.
Yes.
So where do you advise people to start learning?
Um, that's that's another great question. So I my way is not, it's not my way or the highway, but what I recommend is what worked for me was number one, you have to make the decision that you're going to do this. And you kind of have to go all in, right? It's not on the fence. Either you're doing it or you're not going to do it. So make your decision, because it's a lifestyle. It's not a diet. It's not a fad. It's not okay, I'm going to do this for a little bit and then I'll go back to my ways. No, if you're not committed to this becoming your new life, don't start it, because you're going to be very discouraged, because there's a big learning curve with it. So that being said, once you're mentally ready to go in, right? Elimination diet. Before doing any supplements or anything, I would do an elimination diet. And the reason I say that is because you may not be allergic to something, but you could be intolerant to it, whereby it's giving you symptoms and you didn't know about it, like negative symptoms. So the elimination diet for me is where I started. And then I also started supplementing with vitamin D, but a good vitamin D, right? You want to make sure that you're not just getting supplements that you would buy at Walmart, because they've got all these additives and fillers in it. That
Yep.
was another thing that I learned. I was like, oh, all vitamins are not the same.
Mm-hmm.
So high quality vitamins, whatever you're taking, and high quality food. But for me, it was making sure my vitamin D was up. I want to say I was around either a 6 or a 9 for my vitamin D level at the beginning of all of this, which is way below where it should be.
Mm-hmm.
Vitamin D is a huge, well, vitamin deficiency is a huge issue for a lot of medical
Yeah.
ailments. So increasing the vitamin D, I'm now at like 99. Um, it's
Wow,
great.
good for
I love it.
you.
Yeah, it's great. It's great. Um, so yeah, the elimination diet to find any food allergies or intolerances is a big one. It's not fun. It's a process, and it's really expensive in the beginning, because in a way you're wasting money to find out what your food triggers are and stuff. So, and have a support system in place, because it's going to get overwhelming, and it's very emotional, right? It's because you have all this trauma stored up in your body, from everything that you've been experiencing, and your body is traumatized too. So your brain and your body are traumatized, and it's going to stay stuck in there. Let it out.
Yes.
The trauma release is huge on it. So for where I would start is definitely the elimination diet, and starting on a basic vitamin D, one thing at a time. Slow and steady wins the race. I'm still figuring things out, right? And here we are almost 3 years later. I'm still figuring things out, but I have a very, very good baseline for stuff for me.
You might have said this, but did you do like IgG testing, food intolerance testing?
Oh, so my ENT doctor suggested it, but he also said they're not necessarily accurate, and they don't test for everything. So I was contemplating it, because I was like, this is so expensive and exhausting. Like, I can't tolerate anything. We know now it's because I have MCAS, mast cell activation syndrome. Again, another condition that I brought forth to my providers to be like, can we maybe look into this? And I was right.
Wow.
Gosh. But they suggested the food testing, but they said it's hit or miss, and it's not always accurate. And then it was the spices. I was like, well, what about this stuff? Because there's hundreds of spices, and well, no, there's no test for that. You just have to try them. And I'm like, well, then I'm just going to continue doing what I'm doing.
Yeah.
It works for me, because also the lab work, right? We get labs that say this is fine, your thyroid's fine, or some blood work is fine. Meanwhile, you've got like a growth on you. Yeah, everything's fine,
Right?
doc. Okay. Everything looks perfect. So I would prefer to go based off of my personal experience. And that also leads you to finding patterns of what you're not good with. The elimination diet is what led me to find that I'm not good with high histamine foods.
Mm-hmm.
So things that are healthy for you, spinach, lemons, I can't have them. Or if I have them, I have a massive reaction to them, like the runny nose, my face gets all red, I swell, I bloat up. Yeah,
So kind
it's
of eliminating everything and bringing one thing in at a time,
yes,
right? To see how your body reacts, whether it's bloating or mucus.
yes.
Mucus is our body's way of getting rid of what's something that it's reacting to. So no, that's smart.
And the support system's a huge thing. When I was doing my
Yes.
elimination diet, because I live alone, right? So it's difficult not having someone to be able to intervene if there was a medical problem. I mean, I can
Mm-hmm.
call 911, but I'd rather not. I was doing lives. I was live streaming on TikTok and trying these new foods with my friends, my mutuals that would come in there and hang out and watch me. And I would eat, sometimes in the beginning, I would eat something and like within 5 minutes, they'd be like, Lynn, your face is all red. And I'd be like scratching and itching, which I do anyways because of my anxiety. So I was
Mm-hmm.
never able to differentiate the two. And they could see me. I would get flushed. And so I'm so grateful for my people over there, my friends. They're so
Good
they
community.
helped me so much. They really did, and they really are. Yeah. But it's so important to have that support in place and
Mm-hmm.
just listen to your body. Yeah. And if you're doing one thing at a time, it's easier to pick up and find these trends and
Yes.
hone in on it. And then also sharing my story and what I'm experiencing has led people to be like, "Well, did you think about this or what about this?" And I'm like, "Oh, good one."
Yeah, and
So,
there's so many smart people on social media. I mean, you really can learn
there
a
are.
lot.
Absolutely.
Have you, by chance, had any of your tests, like the MTHFR or you know MS, even since you did parasite cleanse? By
Have I
chance,
had them done?
have you had any of your tests redone since doing a parasite cleanse?
Yes. So rheumatologist ran a couple of the IgG panels, and I'm still showing up these markers for lupus.
Mm.
We've been trying to figure out rheumatol. I'm on my second rheumatologist too, by the way, because the first one was giving me medicine
Oh.
that wasn't good for my MTHFR mutation. But what do I know?
Yeah.
Um, so yeah, we're still troubleshooting, and that's the thing, right? It's a balancing act, and because my system is so compromised, for lack of a better word, because honestly, doing what the doctors told me for over 30 years made me sicker.
Mm.
I hate to say that, and but it's the truth. When I think about it, it is. All of the medicines that they were giving me made me sicker and beat my body down even more. Yeah.
Well, it doesn't surprise me because, I mean, if you look at, I mean, it's wild even to think about this, but if you really take the time to read the pamphlet that comes with prescription medications, there is not a one that does not come with a list of side effects.
Hmm.
And we are in a system now that you take a prescription, you got 15 side effects. Now you're taking a prescription for the side effect, and now that one's going to create side effects. So it makes sense. I mean, I don't think it's purposeful, at least on the doctor's end, in the most part. It's just what they know, what they've been taught.
Yes.
You know,
I always found that to be funny because, again, a chronic migraine sufferer, and they would prescribe. I tried every medication on the planet for my migraines, and what like the number one side effect for these migraine medications was may cause headache.
oh my gosh, we're gonna treat your headache with more headache.
It's just when you think about it, you have to. It's funny when you think about it. Like I'm so past the angry point, but seriously, yeah,
That's wild.
it is.
So, what's your regimen for the MTHFR? Like, what do you specifically do for that?
Specifically for that, I take L-methylfolate
Okay.
instead of a vitamin B complex. It's the bioavailable, one of the bioavailable forms of vitamin B, and it works for me. I get my other B supplements with the food that I eat and things like that. Um, and yeah, my medicine, I was on like 13 different prescription medications, I want to say, and I have replaced it by roughly 10 supplements, and I continue adding. It's not the quantity of what I'm ingesting, it's the quality of what I'm ingesting
Mm-hmm.
that I find to be most important. Yeah.
Mm-hmm. Mm-hmm. Yeah, no, I agree. I should get tested for that because I started the same methylfolate vitamin and have seen I've seen an improvement in
Have you?
myself. Yeah, because I was trying to get off of prescriptions that I had been on for many years. One of them was Vyvanse. I had such a hard time coming off of that. And I replaced it with that in L-tyrosine, and it has made a dramatic change in my life.
Yes.
So
A lot
yeah,
of a lot of people have it. I'm so glad you're doing better and it's helping you. See,
yeah,
that's the
thank you.
thing. We should be feeling good.
Right.
It's so important to be feeling good physically and mentally.
Yep.
It's just,
I know. I mean, I
yeah.
would feel great, being on Vyvanse, and at the end of the day, I was like, I wanted to,
It
murder
made me so,
everybody. Like,
yes, it made me so angry. The ADHD meds.
yes, it was
Yeah.
infuriating. So, but that was a really hard one to come off of. But this has been a great supplement. So,
It's helped a lot. It helps a lot of people. And
hmm
also with MTHFR, there's a lot of medications. Like I had an eye issue going on. I had intermediate uveitis, and they needed to calm down my system because my body was just getting attacked more. And that's when my first rheumatologist put me on methotrexate and folic acid to supplement it.
hmm
With MTHFR, you can't take folic acid.
hmm
You need the bioavailable form, which is the folate, right? And the methotrexate is an absolute no-no with the MTHFR. We can't metabolize it. So it was making me very, very, I was in and out of the hospital regularly with that one.
Were you?
Um, yeah, it's not just the L-methylfolate. There's so many things that you're supposed to avoid or replace with other stuff when you have that and other genetic mutations. And it's not just one. There's many cofactors that get involved with it. It's very complex. It's not simple.
hmm
It's not. And if you're able to have a naturopath and pay for someone to do these labs and testing and things like that, do it. It's your
Worth
health
every
is worth
penny.
it. It's worth every single penny. It really, and it's a lot in the beginning. It's very, very overwhelming. And it's everybody's body is different. It's a balancing act. What works for you may not work for someone else. But do
And
you want to
that's
feel better?
right. And that's so true because it's like how it stands now is, again, do you fit in this box? Here's your treatment regimen.
Hmm.
I mean, it's literally they've got books to here's your diagnosis, here's your treatment, here's your diagnosis, here's your treatment. So we all are different just because we're made up of the same type of organs and cells. Like we are very different people, and what we consume and allow on and in our bodies changes things drastically.
Absolutely, it does.
Yeah. So, um, another question I wanted to ask you was Ehlers-Danlos. When did that enter into the picture?
Well, it's been here all along,
Yeah.
Emily. Um, oh Lord, that diagnosis is seriously a year old, and
Mm,
that was like pulling teeth. Um, so that it's less than a year old, and that was again, I went out to Boston for that one because I was getting ignored here. And my neurologist out in Boston, he was like, I think you've got something rheumatological going on. Let's, have you get looked at." And I was like, "Great." Um, so that's less than a year old. That was another one where I pulled the DNA because I don't have the classic symptoms. Like I'm not super extra bendy. I can't bend down and touch my toes and things like that, but my left shoulder dislocates, my left hip dislocates. I was always getting injured as a child, always. And they just, "Oh, it's just because you're clumsy." Well,
mm,
no, actually, it's because I'm built different. I don't have enough collagen, so I am getting hurt more often. Um, and yeah, so the Ehlers-Danlos is very new. I'm shifting my focus, honestly, lately because my MS is under control. I've had no new lesions. I do get mini flare-ups and things like that, but I have had no new lesions since March of 2022.
that's
So it
wonderful.
seems that what I'm doing from an MS perspective is helping me significantly. So I'm going to build up off of that. And I came across a supplement, I came across a protocol that's supposed to help Ehlers-Danlos patients. And in looking into this is seriously less than a week that I came across it. There's so many different things that are Ehlers-Danlos. Because of the Ehlers-Danlos, it's impacting all of these various other conditions that I have that they keep blaming on my diabetes, gastroparesis, and a whole slew of everything, because our organs are made up of collagen, and I'm learning a lot about this. This is a big learning curve for me. But the Boston rheumatologist didn't hear me at first. So I went into my DNA, I did some research, and I found out what the genetic markers are for Ehlers-Danlos, and I was like, watch this. I'm thinking to myself, watch this. I have it in my DNA. I bet I probably do. Sure as shit, I did. You might have to edit that out. Sorry.
No, you're good. You can swear. You can swear
okay.
here. Say what you want.
So, you just opened up a can of worms for that one. So I took my DNA stuff and I sent it via email to, the patient portal to the rheumatologist out in Boston who had run other lab work. And she was like, nope, nothing's going on. And I was like, well, I have this. What do you think about that? And she's like, oh, well, we'd have to send you to a geneticist. Why do you have to send me to a geneticist? It's right here.
Yeah, I got it.
Why? And I don't think Medicare covers geneticists. And frankly, I knew what it was. I just needed the stamp, if you will. And you don't need a name for the diagnoses, honestly, but it's so important to have a name for what's going on, so you know what you should avoid and what is okay to do, because that's why. So I sent it to her, and there was a little bit of back and forth with her, but eventually she was like, "Yes, you have Ehlers-Danlos. I just don't know which kind. There's 13 subtypes."
Oh, I didn't know that.
I didn't know it either, and one of them is periodontal Ehlers-Danlos syndrome.
Interesting.
And that's the one that I have. And
how did you narrow
okay.
that down, that's the one you had?
My friend Rachel, well, I looked at it. My friend Rachel, she's no longer with us,
I'm
unfortunately.
sorry.
She passed away. It'll be a year in January. And she, just like me, had pretty much most of the same medical conditions and also a chronic pain patient. And that's a whole separate podcast. But I think of her every day, and I love her so much. And I know she's with me here in spirit. She really is. I told her I was going to keep taking care of myself and keep fighting, and that's what I'm doing.
Good.
But Rachel is the one who's like, Lynn, I think you have Ehlers-Danlos. And I was like, huh. So because of her, I started digging into it more. And she's the one who told me that there's 13 different subtypes. And again, everything getting blamed on my diabetes. I've had periodontal disease since I was in my 20s. And I took great care of my teeth, always went to the dentist. Didn't eat the best, but there was absolutely no reason for that. I had 2 bone graft surgeries, teeth were loose and everything. It was bad. They kept blaming my diabetes. If your diabetes is under better control, you won't have this problem. Okay. Got that all under control and things were still happening. Yeah.
That's really frustrating. I think that happens to a lot of patients. The minute they get a diagnosis, a chronic diagnosis specifically, it's like everything's blamed on that.
It is.
It's really frustrating.
And some of it is, but at the same time, they shouldn't be dismissing it.
Correct.
Yeah. So my front 8 teeth are fake, and I'm okay with it. They're actually better than what my natural teeth were.
They're pretty. I wouldn't have known. So
thank you. So yeah, I found out through Rachel that there's 13 different subtypes, and to me that makes the most sense. So they never did any. That's what we go with, right? There was no more testing that's going on. I'm over it. I don't see a benefit for it. I do have vascular issues in my eyes, and that's another underlying thing that could be a part of the Ehlers-Danlos. But it's all so interconnected, and a lot of the gut health issues, a lot of the GI issues that I have, I think are a lot of Ehlers-Danlos related and not diabetes related. I'm still learning a lot. It's very, very new, but that's been very important. It's been a game changing diagnosis, honestly.
Do you take a collagen supplement?
Not yet.
No. Okay.
Not yet. No, there's a whole protocol involved with it, and you start slow, right? So the first thing I'm starting with is a probiotic, which is great to use anyways. And then there's another one that's called PQQ, and I'm not even going to try to pronounce it. It's a big name for it, but that one is supposed to help big time with the tissues and the eyes and GI stuff. So it's slowly introducing stuff. So yeah, I don't have enough knowledge in the Ehlers-Danlos as a whole to be able to give full advice on it at this time. So I'm just I'm sharing my journey along in this new venturing into the Ehlers-Danlos stuff for me.
Well,
right?
it'd be kind of
So,
cool for people to watch, not cool for you, but cool for people to watch you, from start to finish with something new like this, to see what you find out and what you end up doing. So,
thank you. Yes, and that's what I've been doing all along. It's very therapeutic for me. It is. It's incredibly therapeutic to have the support and people asking questions and giving other suggestions and their experience and not just holistic. Again, it's back and forth. It's Western medicine and everybody. It's interacting with providers, with naturopaths, people like you in the medical community or that were in the medical community and decided to leave, other patients that have gone through similar things. It's I would not be able to do what I do if I didn't have the knowledge and skills that I've learned through these different communities. Yeah.
yeah, I really feel like you have kind of mastered how to do this because, and it's difficult. It's difficult to do that. It's difficult to find your voice for some people, to be able to, kind of stand up for yourself in the industry. But you seem to have found such a good balance of both Western and naturopathic modalities, and being able to use both to what suits you.
Thank you.
So I really commend you for that, because
Thank you. I really appreciate that.
because that's not easy. A lot of people are like one or the other, or I mean, especially somebody who has been mistreated or injured in some sort of way, or just had it up to here with Western medicine or bad experiences. It's very easy to say, I'm done, I'm not going to use it anymore, I'm out of here. But you have found a way to make it work for you.
Yes.
And I really think that that's the answer here, because a lot of people will ask me, how do we change the system? How do we change it? I don't think we do. There is too much money that's backing these things. And it's a business. It's just the way it is. And I don't mean that to sound negative, but I really think it's us that needs to change. We need to change our approach.
Yes.
And remember that it is a service we are paying for, and we deserve good care, and advocacy is so, so important, whether you do it for yourself or you have somebody come along with you to appointments and do it for you. I think that's probably most important.
Yes, I think I saw it, that you were saying it, and I completely agree. And a lot of people say it too, that you don't go to appointments without anyone there. If you are hesitant, and if you're not confident enough, or if you're not comfortable, it doesn't matter the reason. If for some reason you're scared, whatever it is, to speak up in your appointments, and you feel like you're just going to cave and do what they tell you to do, bring someone with you. Have someone on the phone, video calls and things like that. You know what I found? I've noticed this. I don't know if it's happening anywhere else, but here in New York, there's at least 3 providers that I go to, their offices, right? That are with the hospital systems, not the smaller system, not the smaller group providers, but the bigger ones. They actually have signs in there. No recording, no video recording of appointments, because people are posting what they're experiencing online, and they're getting a lot of pushback on it, as they should. As they should. Google reviews, I mean, they matter. People look at them to make sure that they're getting the best care. So I'm noticing that they're not allowing people to do that. And it was, well, I would never go to a provider that had that. I'm like, I don't really have a choice. I have to see these people. I have to sometimes go to the hospital. I don't have a choice. But it's scary, not that they're as part of the patient. It's part of the patient agreement. It's not just a request. It's something that we as patients are signing and agreeing to, that, all right, well, in order to be a patient here, I won't record our visits. It's
And I don't
it's
get
telling.
that. I mean,
I don't get it either.
I get, well, their argument is, well, HIPAA, and could you capture somebody else's, but you're
Yeah.
in a room, You're in,
Right.
if I can see, don't do it in the waiting room, but you're in a room with your provider.
Hmm.
Actually, somebody, I think it was Knowledge, on TikTok.
Hmm. He's
And
great.
I love him.
Yeah,
And
he's brilliant.
oh my gosh, so brilliant. And he said that he thinks every doctor should wear a body cam
Yes,
like
I
police
agree.
officers do.
I
Can you
agree.
imagine how beneficial that would be to patients?
So New York's it's only like a one party consent state, right? So you
Yep.
don't need to have the permission from the other person. But they, I don't even know when, but they recently, within the past couple of years, started the body cams for like the police
Hmm.
officers and stuff like that. And it was like a big, whoa, a big wide awake things and a big wide awake moment.
Hmm.
And they're because they're being held accountable for it. And if they start getting too comfortable, you know, with something inappropriate that they're doing, they're being held accountable and they're being held
Yeah,
liable for it as they should.
as they should.
And that, in my opinion, should also fold over into the medical. It really should.
I
And there
agree.
shouldn't be anything wrong with recording anyways.
Hmm.
There's so much covered in appointments. A lot of us don't have the brain capacity for this. Like it takes me a while to process things,
Hmm.
for various reasons between the multiple sclerosis cognitive issues and the ADHD that's unmedicated issues. It takes a lot for me to soak in everything and truly grasp what's going on.
Hmm.
And I don't write fast enough for these appointments because they're just whisking us in and out.
Yep.
So for me and many others, recording it is actually not. There's no ill intent with it. It's an accommodation,
Yes.
and they'll do that. You can like do something and get permission from them to record. But for me, that's the real reason why I do it, and also to share my experience with other people. Like you should be going to providers that are listening to you and doing this. I prefer to focus, I try my best to focus on the positive side because there's so much negativity in the world in
Mm.
general, and it's not helping, right? So, what is pointing out the bad going to do with when you're not giving suggestions for how to improve it?
Hmm.
This is how you want a provider that's going to do this. Here's the questions you want to ask. Here's how you want to handle yourself. I find it to be very, very beneficial. I really do.
Yeah. Yeah. I had made a video a couple years ago and I just said, listen, after 25 years in healthcare, the best advice I can offer is don't ever go to a hospital alone. Don't ever leave a loved one in a hospital alone. And I didn't mean to, but it scared a lot of people.
Yeah.
And it really actually was what led to this podcast because I realized in that moment, because there were so many people that were like, what? Like, what's going to happen? What's going to happen to us? And I then kind of I made a follow up video leaning on patients and medical professionals to say, hey, help me out here. Help me show, these people that don't understand why I say what I say. And then that scared them. And it's like, well, I'm
Yes.
not trying to scare you, but like the truth is medical malpractice is very, very high in this country. High enough that hospitals employ attorneys. Mistakes happen, whether intentional or not, mistakes happen. And when you're dealing with lives, it can be detrimental. So, and when you're sick or in the hospital, or even to your point, going to a doctor's office and you're being fed so much information, it's really hard to retain all of it. So if you can't record, at least bring somebody with you. But
Yes.
and specifically when you're going to the hospital, my gosh, just so many things can happen.
There are. I actually, really quickly, I had neck fusion surgery in 2022,
Hmm.
April of 2022, and it was an overnight thing because of my diabetes. They want to make sure there's they monitor me closely
Yeah.
for infection because I'm much higher risk, and I agree with that
Yes,
completely.
absolutely.
However, um, they weren't giving me insulin. They weren't giving me my insulin.
Oh my.
And I had it with me, right? But I was so medicated, I was not going to do anything. You're familiar because you're a nurse,
Yeah.
but like the difference between 1 unit of insulin and 10 units of insulin,
Huge.
huge
Huge.
difference. But if you're visually looking at it, you're like, not much of a difference. So
Yeah.
it can wreak havoc on you. So I was not comfortable doing that. But my blood sugar was like 300 something, like in the morning. The next day I woke up and I was like, you guys haven't given me my insulin. And then they started giving me food to eat without insulin. And I'm like, what is going on here? And then there was a shift change. And then my new nurse came in and she was a diabetic and she's like, oh, hell no. So, and she's like, I'm taking care of this right now. And she marched her, but they didn't have any orders to give me insulin. It's like, wow. You guys probably should have had this all figured out. And I've
Correct.
never had that issue, and I always have stuff with me, but they also weren't allowing my parents to come in. I could have one visitor, one
Oh,
person
because of
visit.
COVID.
Yep, because for 2 hours a day. That was it.
Oh my gosh.
That was the visiting that was allowed. And
And
yes.
honestly, like I would see that happen a lot when I worked. I did inpatient peds for quite a while, and I would see that happen a lot. We would get an overflow of surgical patients, and because it
Hmm.
wasn't our, we were the overflow floor, so it wasn't our niche, I guess. But
Yeah.
so many times, probably at least. Several patients a shift. I'm going to be honest. That their maintenance meds would be missed because it's like unless the doctor is putting it out there and ordering it from the get-go, it's going to get missed, and
Yeah.
unless you have a good nurse that picks up on it. But
It will. It
shouldn't be
reinforces
that way.
that you gotta. It's my motto is CYA, cover your ass, and you just bring it all. I bring anytime I go to the hospital, I bring them with me. If I'm
Yeah,
having a procedure done, I bring everything with me,
smart.
right? But I also know myself well enough that if I'm not it if I'm incapacitated in one way or another, that includes pain IV pain medications from just having surgery, I'm not going to mess around with it
Yeah,
because one small mistake can take my life, and I
yep,
don't want that to happen.
smart.
Other people might, but I don't want that to happen. You know what I
Oh,
mean? So,
yeah, you're such a
um,
sweetie. I can't imagine anybody would ever
no,
want that to happen.
thank you. Well,
Yeah.
not everybody feels the way. That's okay though.
Well, I
Um,
cannot imagine why. There, that's yeah. I think you're a sweetheart.
I was a very not nice person for a very long time because I was
Oh,
very angry. I've changed a
well,
lot though.
yeah.
You know?
I can understand that. I can
Yeah,
understand that feeling. I've been there.
yeah.
Last question about your health, if you don't mind. Did you do any other testing other than what we've talked about, like mold, toxins, anything like that, or is that something that you ever thought about, or may down the road, or just out of
I'm
curiosity?
scared to do a mold test, right?
Yeah.
So I haven't done any other like home environmental testing or anything like that. It's important, and I'm very much allergic to mold.
Mm-hmm.
So I think if I saw the results of that, it would freak me out.
Yeah.
And I also don't have the finances to be able to do an overhaul of my home, or like the environmental stuff. And it's really not that bad. I keep like a close eye with stuff, and I also don't have too many symptoms
Mm-hmm.
of mold toxicity, although there's some that overlap into other things. But I do these detox baths like once a week, um, with a couple of different things, and I just find that whatever I'm doing is helping me maintain.
Mm-hmm.
I actually wrote this down for
Okay.
us because I didn't want to forget
Yeah.
anything. Um, but there's the things that I do for managing everything. It's actually quite simple, but then the part of them is complex. If you want me to tell you like what was important for me,
Yeah.
so obviously you want to have like blood work, like your basic labs that you're getting from any provider. This is again without the naturopath
Mm-hmm.
intervention. So it was determining the genetic vulnerabilities because epigenetics is real. Just because something's in your DNA, it doesn't mean you're going to have it. But if you're given the right or wrong environmental stuff, that switch can turn on and you're going to start having that condition.
Yep.
And I think that's what happened to me is because of everything I was intolerant to being forced down my throats via medicine, and also the bad stuff in the food, it contributed to the epigenetics flipping on and me getting bombarded with one thing after another. The vitamin deficiencies is another huge root cause, heavy metals and parasites, hormone imbalances, uh, and eliminating the toxins and allergens. I did go to an ENT who did the allergy testing. I'm allergic to everything besides cockroaches.
Oh my gosh.
I don't want a pet cockroach, but no, like so, like I'm good. I'm
Yeah,
good
I'm
on
good
that.
with that one.
But all like environmental and like the dairy and all this other stuff, I popped up positive for everything except for cockroaches. I had a dog, and she was my emotional support dog, Chloe. I miss her so
Oh,
much, but I had to rehome her. I got to the point where I couldn't breathe, and I was waking up in hives, and I physically couldn't care for her. I couldn't get her out to take her on the regular walks and stuff, and it wasn't fair to her.
yeah.
So that was the most one of the most selfless decisions I had to make and difficult,
Yeah, I'm
very, very
sure.
difficult. So eliminating toxins and allergens, because our skin is the largest organ. It is. So that's environmental, food and drinks, self-care, cleaning, laundry products, and I have on here mold exposure, right?
Mm-hmm.
Um, so ensuring that you have the healthiest environment possible, identifying food and ingredient intolerances and allergies, and improving your gut health and eating organic. Um, Identify vitamin deficiencies. I already said that, and emotional trauma.
It's a
Emotional
big one.
trauma will keep you sick and make you sicker.
Oh, it will.
So it's an all-encompassing entire body management. It really, really is.
Mm-hmm.
And anything that comes up for me that someone suggests or that I feel is going wrong, I will ask for more testing. I will. I just tend to go with whatever is covered by insurance because being permanently disabled and on Social Security disability, there's not a lot of there's not a lot of disposable income.
Yeah.
It's they certainly don't make it easy for us, you know?
Agreed. Yep.
Yeah.
Yeah, I just to go into that to the emotional trauma, the importance of that. So, and I have a wonderful family. My parents are wonderful people, very supportive, but I come from a divorced family and they divorced young. I was 4 years old when they divorced. And so there was a time period in my life that I had literally blocked out. I didn't remember from 4 to about 10. And I started getting really, I already was not in the greatest health, but I noticed that every time I was going to see my parents or my parents were going to come to visit me, I would get sick physically. I would throw up. I would be just so sick. And I finally reached out to a therapist. Actually, she was more of a life coach, but she had a therapist background. But anyway, she was very spiritual, and she said to me when I explained this to her, because I'm like, I don't know why, but it seems to happen around this time. And I thought I was going through like menopause. And she was like, I think you need to deal with some things in your childhood. And so I did a brain spotting treatment therapy with her. And it was hard. It was really hard to go back to those memories, but I was able to remember things. And from that point forward, once I got through that, it took about, maybe 3 to 4 months. Everything went away. My symptoms went away. My parents would come down. I visit my parents, wasn't getting sick anymore. I had to get those. And how she explained it to me was that our minds don't necessarily remember the events. Like a lot of times our brains will block those out to protect us. But when it does that, it also blocks out the emotion. And so the emotion stays stored and dormant. And it doesn't know what to do. She's like, basically, when your parents come around, because you've had these things that you haven't dealt with yet, your body says, okay, I'm just going to make you sick so you don't have to deal with it.
Yes.
And that's so true. And it was life changing and again, my parents are great people. It was a messy divorce. That's all there is to it. But it was so impactful and so life changing to finally deal with that and be able to move on with my life. But it still amazes me to this day, like that's what my body did to protect me, like made me sick.
Yes.
So I agree the importance of letting your emotions out. And you don't necessarily have to do it. You don't need validation from other people. Like you can sit there and cry alone if you have to, or scream, or do whatever you need to do. You got to get it out.
Yes.
Thank
you for sharing that, because it's a very vulnerable position to be in, right? And it's scary. It really is scary. And I've got a lot of trauma in my life, right? And any trauma, only the person that experienced whatever they experienced gets to decide if it was traumatic to them, right? So, and my traumas are maybe nothing compared to other people, but to me, they're big and they were very impactful. And I've been in therapy for a very, very long time. I'm very open about it, and therapy helps me significantly. But I wasn't letting therapy help me in the ways that I needed it to, because I wasn't being fully vulnerable about it, because I wasn't ready to. My body and my mind were not ready to. I was just there as almost, in a sense, the validation. They're like, yeah, well, you experienced what you experienced and talk about it. But there was no, here's how we're going to do some solutions.
Mm-hmm.
So for me, getting my physical body under a bit better control where I physically felt better, I was then able to be like, all right, there's some mental health stuff going on. Again, like the anxiety attacks and panic attacks that I was having going to these appointments. I'm like, what the heck is going on? And I knew it was the anxiety, but I'm like, there's got to be a better way to manage this stuff. So taking care of the mental health piece and genuinely working on it, and I continue to work on it too. There's a lot to work through, has improved my quality of life so much. It's not even funny. But I was not physically able to do that. I was just surviving.
Yeah, you're in
It was
constant fight or flight.
Yes.
Yeah.
And the body does that. Your body's going to take it on. We store a lot of trauma in our hips, a lot of the back problems and stuff you get, and the hip stuff, that's stored trauma. And I learned that relatively recently. A lot of my stuff is a lot of my back injuries are, my back issues are injury related, but a lot of it is, again, the Ehlers-Danlos. I'm just built differently, but a lot of it is from holding on to trauma. You're complaining too much, so then you be quiet and then you internalize everything. It's so important. It's so important. And it doesn't dismiss the physical symptoms that you're feeling. It just means there's more than one reason for it.
Yes.
So physically feeling better, and that includes getting on pain management medication that I was very much against. I had a lot of my own negative feelings about it because of what I grew up around and experienced into adulthood too. It was very much a trigger for me. So identifying, not only are you like identifying food and environmental triggers, you should identify emotional triggers because it sets, when something makes you angry or sad or mad, your heart starts going.
Yep.
So you're putting more pressure and more work on your body. So the emotion regulation has been huge, and resolving a lot of that conflict and that turmoil has been wonderful. My parents are still together, and I'm so grateful for them. And they absolutely did the best that they could. And my brother and I weren't exactly the easiest teenagers to deal with,
Yeah.
But we have a phenomenal relationship now. And I never thought it would like blossom into this beautiful thing, but it really is. They were a big part of the gaslighting, right? And we've all come clean to it. We're all on the same page. We're at a great place right now, but with the constant stuff from growing up with always getting hurt and them not knowing how to deal with it because no one in the family was sick. When I was out there for my multiple sclerosis testing and things like that, that's when it hit them big time. So in 2021, that's when they were like, our kid is really sick. And she's not exaggerating. No wonder why she's having such a hard time. So it's healed a lot in me. And then it provides even more support, and there's some people that we don't interact anymore. And I wish them the best. I wish nothing but wonderful things for them. But if someone is bringing stress into my life, I can't have them in my life. I'll talk to them about it, maybe. But if it's an ongoing pattern, I'll exit quietly and I'll walk around. It's not an airport. I don't need to announce my exit. I'm just going to fade back, but it doesn't mean I don't wish them well, but yeah, the mental health has been a huge thing, and coming to terms with thinking about things differently and letting go of preconceived notions and false beliefs that I had, right? And educating and learning from other people that have struggled with things. I just have a completely different perspective on things. I really do. And again, that's come out through the TikTok community.
Aww.
Yeah.
That's wonderful. If there's one great thing about TikTok, it is that it's provided community for many of us.
Absolutely.
I like that it kind of puts us in these groups of like-minded people. And that's great. I'm so glad that you've been able to heal with your parents. And I mean, I know as a mother, I'd be devastated if I've been there actually. I've been there with my daughter, thinking that she's exaggerating things. Well, it turns out she wasn't. I actually just took her to the chiropractor recently, and her poor back is like, and I'm like, oh my gosh, I thought you were just a complainer. Sorry,
It happens. But you see, you took ownership of it,
yeah.
though,
That's
and
the
that's
important,
so.
Yeah,
It is. It's if someone's going, or people are going to continue being dismissive and being like, oh, well, it's
So your
not
back looks like a
healthy.
C. Big deal.
Right. Yeah, so no big deal. Well, mine looks like this, so
Oh,
it's no.
yeah.
Everyone's experiences are valid, and it's
Yes.
extreme to them, and yeah,
Yeah.
it's interesting.
It is. It is. But I'm glad you peeled that. Is there anything else that you would like to talk about or go over?
Um, the only thing that I really want to say is kind of more along the lines of like, you just be nice. Be nice to people, be kind, be compassionate. And if you don't, then just don't involve for whatever reason. If you are envious or jealous that someone is getting care and you are not for whatever reason, just move on or ask for help. And don't be afraid to ask for help. Don't be afraid to learn something new. Don't be afraid to say no. Don't be afraid to say, I'll try it, right? And that's the biggest thing for me is I never liked asking for help. And um, it still takes a lot for me to do it now. I almost formed like a hyper independence coping and defensive mechanism. And it's a lot of stress and people will help you, right? And I'm not talking about giving you things. I'm not
Yeah.
talking about materialistic things. That emotional support is huge. It really, really
It
is.
is.
And you don't have to agree with things, but just being open to other people's perspectives and taking a little bit and learning. Right? I love learning. I crave learning. It's my thing. And there's just so much hate in this world and it hurts me. It hurts me so badly and I don't want anything to do with it. It actually makes me a bit more of a hermit in a way. So I wish that people were more compassionate and more understanding. And if it's not for you, then just go on your merry little
Yeah,
way
be
and leave other
nice.
people alone.
Yeah.
Yeah. And so taking ownership of your health, your overall health and your well-being is it's so
It's your
crucial.
job.
It's so important. It
Yep.
is. It is. And that's my job being disabled. You don't work a 9 to 5. No, I work a 24/7 with
Yeah.
no vacation days and no
Oh.
sick days. Like, you know what I mean?
Yeah,
Like,
I do.
I wish I could go back to working. I loved working.
What did you do prior? What was your professional, if you don't mind me asking?
Oh, I don't mind at all. I my career was with the state of New York.
Mhm.
And I was I was a budget analyst. So I worked on negotiating the budget with the governor and executing the budget,
Mhm.
monitoring spending trends and things like that. And then after that, I did a lateral transfer, which means the same pay and stuff, just to a different title. I was an IT specialist. So I was working behind the scenes on the computer programs that helped develop the budget and main, the expenditures for the state of New York. It was rewarding but very eye-opening, and we'll just leave it at that.
Yeah,
It's
I'm
in
sure.
a good way. Like the insurance, the benefits were great, but in a roundabout way, I'm glad that I'm no longer able to work because I don't agree with a lot of the way that things are done. But
Yeah.
I had a really really good job security, and for the most part, I did enjoy what I was doing.
Oh,
Yeah.
good. Well, where can people find you on social media?
My handle is Linit to Win It on
I love that.
everything. Thank you,
Hmm.
thank you. Um, but on TikTok, my TikTok is public. It's for everybody. I am on Instagram. I leave that private because I do have some, like, like personal family things and stuff and location stuff on there. But people can message me on there if they want to. And I recently started a Facebook with Linit to Win It that is like housing a lot of the medical stuff and a lot of my experiences, and I'm still kind of building up on it. But yeah, Limit to Win It is where I am for everything. It's patient advocacy because that includes educating ourselves.
Well, you
It
are a
really
good
encompasses it
advocate.
all. Thank you.
Do you help other people advocate? Like you help other patients advocate?
I do in the sense of I educate them and like
Hmm.
I don't participate with them. So I won't do like phone calls with them. I won't go with them to appointments. I will for local friends of mine. Yeah, absolutely. But I don't provide that as like a service thing, but I take what I have learned and I share it on my platform in the hopes that it helps other people to be able to take that and utilize it for to better themselves. And a lot of them have. So yeah.
You could create a service out of that, honestly.
I could.
There is a need.
It's one of those things where I enjoy what I do it, and if it ends up becoming a job, I'll lose my passion for it.
Mm, yeah. I see that.
That's just it's just not for me. There's a lot of people that I've met on TikTok that do provide those services and
Mm-hmm.
get compensated for it. It's just not for me.
Yeah,
And
I
I
get
love
that.
that for them. I really do. It's great.
Yeah, yeah, for
For
them.
them, yes, it's just not for me.
Okay, last question. Did you watch the Floxed episode by chance that I had Talia on?
Yes.
Okay. Are you familiar with her? Have you seen her?
I hadn't seen her before
Oh,
that.
yeah,
It was a great episode, by the way.
yeah, she's interesting because she's kind of done the same kind of dug down and had to do a lot. I mean, she was on her they had her on hospice.
Yeah, yeah,
So she's another, and she really not only has she survived and healed, but now she's doing some great work in making changes. She just got a diagnosis code entered. I mean, she's doing some great work. So
that's wonderful.
yeah,
I love that so much.
I do too. I think you both. I mean, again, I commend people like you. I have so much respect and admiration. I I feel like I've had to kind of unlearn and now relearn, and I'm trying, but man, it's an uphill battle.
It is.
You
It
know?
is. It is,
Ah,
and we're grateful that you have an open mind and you're providing this platform for us, and honestly taking ownership in a way of being like, wow, I did all of your career. You left your career.
yeah.
You did. You left what you were comfortable in and what you knew. You were there for what, 25
20,
years?
yeah, 25, almost 25 years.
Yeah,
Yeah.
I mean, that says a lot. It really does. It says a lot about who you are as a person, right? It means you're going to stick to your guns and what you believe in, but also it calls out how flawed the system really truly is.
Mm-hmm.
A- And I admire you for going out and doing this. This is a very big risk to be putting your name out like this and doing this platform, and it's scary.
Yeah.
It's just
Well, thank
it's
you for saying that.
incredible.
I appreciate you saying
You're
that.
welcome. I mean it. I really mean it.
I really, really appreciate that. It's definitely, I can't believe it took me 25 years to realize that the system was as bad as it is. But it was kind of like an aha moment once I realized that I will never forget that day. I will not be part of a system that is hurting people. And then
Yeah.
you go through these and I've talked to another nurse, and she went through the same thing. It's like you go through this array of emotions, guilt because you've been part of it, and have you hurt people? You didn't mean to, but you did. Have you? You probably, and then you have this, so, anger and sadness, and it's like you're grieving, a career that you identified yourself with. Like, I was a nurse. I didn't work as a nurse. I was a nurse. So that's been a hard
Yeah.
transition, but worth it. I feel like I'm helping people far more now doing this than I ever did working
Yes.
in the system. So
It's one of the questions I ask everybody. Are you happy with what you do? It doesn't matter what you do, but does it make you happy? Are you
hmm
helping others, and is it helping you?
yeah.
It's admirable.
Admirable. Yes, that's cute. Well, Lynn, thank you so much for taking the time to talk with me today.
Of
Always a
course. Thank you for
pleasure.
having
Of
me.
course.